Dr. Leah, how soon after unprotected sex should I take emergency contraception? Are there weight restrictions?
Emergency contraception is a way to prevent pregnancy after unprotected sex. It's often called the morning after pill, but this is misleading since emergency contraceptive pills can be taken up to 120 hours or 5 days after having unprotected sex. Keep in mind, most emergency contraception methods work best when taken within 72 hours after intercourse. So, emergency contraceptive pills work by delaying ovulation or the release of an egg during the monthly cycle, and they also make it less likely that a fertilized egg will implant. Note, this is not an abortion pill. If fertilization and implantation have already happened, emergency contraception pills will not interrupt the pregnancy. And even 1% to 2% of women who use emergency contraceptive pills will become pregnant despite taking the pills within that 72 hours after having unprotected sex. Emergency contraception does not protect against STIs or sexually transmitted infections. One type of emergency contraception, Ella, works well up to 5 days after unprotected sex, but it's only available by prescription. Most emergency contraceptive pills are available over the counter at drugstores and pharmacies for anyone of age without a prescription. Emergency contraceptive pills can cause some minor side effects for a few days, which would include nausea, vomiting, breast tenderness, and headaches. The menstrual cycle may also be temporarily irregular after taking emergency contraception. As for your question, Plan B does have a weight limit of 155 pounds, but it is still safe to take even if you fall above the recommended weight limit. There's a small chance they might not be as effective, but it's not likely to cause any health risks. An IUD can also be used as emergency contraception, but it needs to be placed by a doctor or nurse practitioner, and this needs to be done at a doctor's office or health clinic, and weight does not affect the effectiveness.